good evening, all of you. Those of you who are here, it's wonderful to have all of you in this session, and welcome to Curiosity Talks. So these sessions are brought to you by WisdomCircle, and they are a way of bringing wisdom from the wise to the curious. So today in this exclusive session that is hosted by WisdomCircle, we have none other than Dr. Namita Mittal, who's the clinical head at Antara Assisted Care Services, and she breaks the silence around menopause with warmth, science, and practical insights. So welcome, Dr. Namita.
Well, thank you, Swati, for giving such a good introduction.
I have a lot more to say. So,
Okay.
Dr. Namita is a dedicated and a postgraduate medico with 20 years of clinical and administrative experience in leading healthcare teams. And presently, she is heading clinical operations in senior care settings at Antara ACSL. So, in her capacity, she ensures that all her teams deliver their service with a senior centric approach that focuses on empathy and responsible action. I invite her now to shed light on the much maligned phase in women's lives, which is called menopause. Dr. Namita, over to you.
So, once again, thanks to Swati for my introduction, and a good evening to a very warm welcome to all of you. So, Swati has started with the word much maligned phase, coming to the subject, menopause. So, that's what we are going to talk about today. And I think I saw one question from Nija, which I will be taking later. So, menopause, I'll just like to break the ice about the topic is it's a natural transition of life for every woman, just like, puberty. Again, menarche is there. So in this social scenario now, we see that people they are much aware about menarche, the periods, the menstrual period, the cycle, when it starts, and how a girl goes through those cycles and prepare her for the reproductive life. But yes, much information is lacking about menopause. So over to Swati, for the queries and for the part which the participants have. Yeah.
To start with, we will launch with a very basic question that what is menopause and why is it such a hush hush, idea among Indian women?
So I think this introduction I've already given. At birth, we have around 1 to 2 million eggs in the ovary, which over a period of time till puberty, there are only 3 to 5 lakhs. And during the menopause, it's not that there are around some 10,000 eggs in all, but yes, because of the hormonal influence, they are not functioning. So coming to the definition of woman, menopause. Menopause, we say when a woman has ceased her period and continuously she has not got her periods for 12 months. So it is a retrospective diagnosis when a woman has not got her periods over a period of 12 months. We say that she has achieved menopause. And yes, it's very practical. Why? It's a hush hush topic in the Indian scenario, because the conventional Indian mentality is that menopause is related to ageism. It is also people have myth about their sexual lives, and also partly it is with the women also because they don't want to talk about their hormonal issues. So firstly, they don't want to share with the family, their kids, and they don't want to share with the colleague. But the good news is now the ice is breaking. We do have certain scenarios, even in the media and even in some of the movies, we see that, the topic is being taken up where they're showing the issues, and, uh, there's a communication, there's a talk about it.
And what would be, Dr. Namita, there are, some very common emotional and physical symptoms that we all go through. So what would those be?
So, once the period they are not coming, it is not that all women will have the symptoms. Normally, for 60 to 70% of the women, it's a smooth cycle, and in fact, in 30 to 40%, they will have symptoms. All of us would have experienced those symptoms during the perimenopause phase and when we are coming to the menopause. But the most common symptom is hot flashes and night sweats, and because they usually happen during the night, so insomnia, lack of sleep becomes another. And of course, mood swings, anxiety, depression, low mood, feeling of isolation, they also predominate. Some women, they have difficulty during coitus. Some women, they have urinary incontinence, which is related to stress. And some memory and cognitive problems, they also come. So but usually 85% of the women, they experience hot flashes and night sweats and insomnia related issues and mood swings.
Doctor, on the slide, I also see a word that I don't know, pseudocyesis.
Okay, so yes, this is very interesting. With some women, when they are not getting the period, they think they are pregnant.
Okay,
So, they are fearful about it.
okay,
And then, they'll come for the consultation because normally when we say ki period nahi aa raha hai, so that means ki maybe you have conceived. Unless and until, it is some other pathology as per the doctor, it could be dysfunctional uterine bleed or, period. There's some other reason. There could be other reasons also.
okay,
So some women, they have the feeling that they're pregnant.
okay. And these are, of course, all the natural symptoms that we have. But are there any, symptoms which will raise red flags, which will require medical intervention, which, we should pay attention to during this phase?
Yeah, certainly. So, Swati, what happens that any of these symptoms, if they do not resolve, either with the natural treatment, guidance, and HRT, and if they persist, then, we need to investigate it further. So, like a woman who is not menstruating, but say after a period of 1 year, she sees spots, and blood spots. So then this is called as postmenopausal bleeding. It could be because of some uterine cancer. There could be some ovarian issues. So then it has to be investigated. Either, and if these night sweats and hot flashes, they are present in a number of other conditions like hypothyroidism, in some leukemias, lymphomas, and some autoimmune disorders. So any of the symptoms like cognitive changes, because it's a time for dementia can also set in, and other depressive episodes, standalone psychiatric issues could be there. So mood changes and unexplained weight changes could be because of other diseases also. So once the symptoms are not resolving after your lifestyle management and nutrition, and after HRT also, they would need further investigation and evaluation.
And also, doctor, I have very often heard, I don't know if it's a myth, where women very often say that, because of menopause, automatically we put on weight. So is there any truth to that, or is it uh,
Yeah, yes. So it is not partly, it's partly true in the sense that weight, women can lose weight and can put on also. But with the active intervention, lifestyle changes, it can be controlled. Some women can have, brittle hair, they can have dry skin. And so it is very individual. And it's not that everyone would have those symptoms. So it varies, but yes, put on, they especially, because of the hormonal imbalance, they can put weight around hips. So we have seen cases, but when they took active interventions, then gradually with the lifestyle change, exercises, within say 6 months to 1 year, they were able to come back to their original weight.
okay? And also, doctor, to add to this wonderful bouquet of symptoms that we have, women also experience mental health challenges like anxiety and mood swings. So, what do doctors normally advise, to make sure that they maintain their well-being?
So, these mood swings, emotional stability is very important at any phase of life. So, first important thing for any woman who is going through this phase, she need to seek support. She need to vent out her feelings, that what she's feeling. And then, she can go for counseling also. Either she can go for individual one-to-one counseling, or she can go for group counseling also. So at Antara, our community, we have support groups where, we encourage our seniors and women, senior women to come out with these issues, and we arrange the sessions for them.
So there is counseling and there is support
Yes.
in these sessions, right? And I think probably diet, exercise, and sleep is very important.
We're talking about the lifestyle changes.
Yes, about the lifestyle changes, the importance of managing that lifestyle,
Yeah.
in which diet and nutrition, sleep, all of that I think plays a big role at this time of life.
Yeah. So, as I initially said, the symptoms they can be managed by your active intervention of lifestyle, or if they are not resolved, then one has to go for HRT. For that also, we have to evaluate, the right candidate who can be given. But yes, as you rightly said, lifestyle plays a very important role. So before that, I have added there are certain phobias, which come with menopause. So for that, counseling is important. Coming to the diet, a diet which is balanced diet, which is rich in calcium, vitamin D, which preserves your bone loss, which preserves your bone health, so that the bone loss which happens during menstruation in aged women, that is covered. And of course, protein, enough good protein, healthy fats, adequate amount of minerals, zinc, magnesium. So a balanced diet is very essential. And I'll also tell what is to be not, what we should not consume, because some of the diet components, they can also flare up the symptoms.
Okay.
So, like soya is one which we should consume, because soya has natural phytoestrogens. So they are similar to estrogen, and since the body has is producing less estrogen because of the hormonal influence. So if you are consuming soya, say 45 to 60 gram, it will give you some amount of phytoestrogen. Similarly, some of the high processed food, it has been seen, research studies have shown that they flare up the symptom, say very fried foods, processed foods, potato chips, candies, the sugary drinks, which have a lot of sugar added in them, and even high salt foods. So they should be avoided. And of course, coming to smoking, so smoking, it has been seen that it is anti-estrogenic, so smoking should be avoided. Staying active is very essential because it gives you balance, coordination, flexibility, and not only it revitalizes you, and it also leads to production of good hormones. So endorphins are released. So they are natural antidepressants. So that is how some of the menopausal symptoms can be combated. And women, they can start off with weight bearing exercise like light aerobics or walking. They can set a routine for walking, and relaxation techniques like they can join fitness club, yoga classes. At Antara, we provide a host of services, like fitness classes, we have yoga classes, nutrition guidance we give, we have physiotherapy sessions also. So the whole plus besides that, they can figure out what relaxes them. So some women, they used to tell me, even simply singing, listening to songs, it relaxes them, or deep breathing relaxes them. So it's for every woman, it's a very unique journey. And, with the available options, they have to pick the right method which is working for them. And you mentioned about sleep, 6 to 8 hours of good sleep is very essential. But what happens that sometimes when they are having these night sweats, so they happen during a night, suddenly the sleep is disrupted, and there's a hot flash episode which usually lasts 2 to 5 minutes. And then, there's a lot of flushing towards the facial area and followed by sweats. So if the disturbed sleep is there, And if it is not controlled, then we suggest, antidepressants also, which they can take under the advice of a physician, but only if this treatment is required if it is not controlled with the lifestyle changes. And hydration is very essential. At least women, they should consume to 0.5 to 2.7 liters of water. And even the hot flashes which happens, so there's a lot of vasodilatation, so the water requirement increases. So if they're having, they have to increase their water intake. If they're having these hot flashes, per episode 500 ml of water has to be added.
And we have often heard, and we know as lay people that estrogen reduces, and we always know about this hormone replacement therapy, but we don't know if it's for everyone. So, is it safe, and when is it advised?
So very good question, Swati. The thing is that HRT was very common, say 30, 40 years back. कि, women को menopause हुआ and they'll say कि, okay, you have to have HRT.
Yeah.
And HRT comes in various forms. Like, you have estrogens. When you are taking estrogens, so if you have a uterus, then you have to take the progesterone because there is a risk of endometrial carcinoma. So over the years, they found that it is not very safe for women. So first of all, HRT is not for everyone. It will not suit everyone also. So one has to be very prudent, and it has its side effects also in terms of, say, endometrial carcinoma. It has some of the side effects if it's not suiting. It can long term side effects could be a breast carcinoma also. So who all will need HRT? So one is the symptomatic women. So as I said, most of the women will not have much of symptoms. It is in 30-40%, and in whom the symptoms are not resolving. So then we can consider for HRT. And some of the high risk cases like menopausal complications are there, like if there is a premature menopause and if there is an early menopause, and these women, they are more prone to bone loss and cardiovascular diseases. So in these women, we give it as a prophylactic therapy, so that the years during which, say, if a woman had a surgery at 40 years and the normal her menopausal age would have been 48 to 50 years, and she is showing symptoms of bone loss or some cardiovascular disease vulnerability, so we'll give her for 5-6 years till the age of her natural menopause. So
Okay.
these are the two indication. One is a therapeutic and one is a prophylactic.
I think there was a question, what is prophylaxis?
So prophylaxis is when they have not started the menopause, and say a woman, she has undergone chemotherapy. She is undergoing chemotherapy for cancer, and because of that, her ovaries, the estrogens, the production is not there, and it is affecting the ovaries estrogen production. So it is surgical menopause or chemo menopause because of chemotherapy.
Okay.
In those women, prophylactically, we will add to the regime estrogen also, because
Okay.
chemotherapy is inhibiting estrogen
Right.
production.
And would there be any preventive health checks or screening that women above 45 should actually do?
Yeah, just I would complete my answer. I think the therapeutic HRT in I'll just add to my last question and then I'll come back to your question.
Sure, sure.
The therapeutic HRT we give when the vasomotor symptoms are not resolving. She is having urinary symptoms. There is sexual disharmony with dyspareunia. So dyspareunia is a painful coitus, which because of the dry vagina, many women, during coitus, they found the intercourse very painful. And then they come to the gynecologist saying that, it's very painful. So it's not that the therapy is always oral therapy. The good part is that we have oral estrogens also, and we have the local estrogen, which acts in the form of vaginal cream, gel, or rings. So, based on the symptoms, those treatments can be suggested rather than, popping the pills, estrogen pills. We can give, the good thing is we can give the local treatment also.
Okay.
And also the psychosomatic symptoms, they need to be treated with HRT. Only thing is that now the recommendations are HRT should not be prolonged. So we have to give a trial of 3 to 6 months. And normally it has been seen in majority of the women, the symptoms would resolve. And after the stoppage of HRT, their bodies, they set in a natural rhythm. I think your next question was,
Yes, about the preventive health checkups. What should women above 45?
yeah. It is very essential. We actually advocate for everyone, but since the topic says we're talking about menopause, it's very essential because, as we said, estrogen is cardioprotective. Estrogen is related to bone health. So these women, they should regularly go for their blood pressure check. They should go for blood sugar. They should go for bone density scans. They should go for examinations like mammography, pelvic scans, and yearly they should take these examinations so that if anything is there, it can be detected and treated in time. And at Antara, we have, the wellness packages plan wherein, we have a structured assessment plan for our seniors and women, and we do the reassessments and we track their long-term health.
You also mentioned in your earlier answer that about early or premature menopause. And is there any particular way that such women should approach for the care and the planning of this early menopause?
Yeah, certainly. So, as I said, that these women, once, say a premature menopause has happened in a lady whose age is less than 40 years, and it's a discretion that she doesn't want that any bone or cardiac issues should happen. So then it has to be assessed by her gynecologist that if she's a right candidate. So as you know, there's some contraindications for HRT. So if you have, there's a family history of cancer, or if you had breast cancer, or if you are having a uterine cancer, history of uterine cancer, there's a previous history of any thromboembolic episode, or you are having liver and gallbladder disease, or uterine fibroids. So these are certain contraindications even for these women. So it has to be carefully evaluated by a gynecologist, and then accordingly she'll advise the HRT to you.
So, menopause, we often see it comes at that exact time in life. One is there is the empty nest syndrome, children are leaving, we may be retiring from jobs, and we may be doing caregiving for the older generation who live with us. How do such women maintain their sense of identity and independence? How do we go through that?
So, very, very important and pertinent question because, first is, Swati, what I feel is that we have to, the women has to identify that it is a transition phase, and she has to embrace it because sometimes I have seen patients, coming, they are wallowing in self pity, they are so overwhelmed by the entire situation. So first of all, the ability to see that this is the natural and transition phase and these things are happening, so embracing it positively. ज्यादातर क्या होता है, लेडीज ओपन अप नहीं होती हैं कि ये सब आ रहा है, तो दे व्हाट वी टेल देम इज दैट यू have to seek support, you have to ask for help. So sometimes major counseling session is that we try to find out, she would come out with other symptoms, but actually the hormonal imbalance is there in the background. Sometimes she herself is not able to understand. So that is how, education and awareness, and that's why we are talking, about this, that there is a reason for these sign and symptoms. They will gradually go away with time with your active intervention. So you have to embrace this phase positively. You have to seek support. You have, if many women, they're working, and then they have to create a balance. It's not between their work, their family, and their personal life, because this phase require, self-care. You have to have a structured routine for yourself. Either it's a morning routine, evening routine, where you are taking care of your diet, you're exercising, you're relaxing yourself, you're taking proper sleep, and for that some family adjustments have to also be done. So this is all about, the in a nutshell. And सबसे ज्यादा अगर आप कहोगे तो मैं यही बोलूंगी कि they should seek support. They should come out for counseling sessions, which are very helpful.
So this is, yeah, they have to be proactive about it. How could the partner or the family also give support?
Yeah, so the family has a major role, Swati, here because what happens is they see that lady of the house is, not well, or there's some outbursts, so they will not understand. So family also has to know, just like I was saying about the puberty. Now people know, even in the office, there's a culture that when if a female is having periods, they understand. Family also understands. So same shift has to be there for menopause. And in West, we see many companies also they provide menopausal support. So family also has to understand. They have to educate themselves that this is a phase, there's some hormonal imbalance is there, which is the reason for these symptoms, which will gradually go away with time. So, communicating with your family, educating them, so that they can give you practical support. Suppose if you don't know that, what the other person is going, which actually happens, and it's very easy for the family, ki, okay, now see, she was already irritated, now she's more irritated. We
Mhm.
don't know the reason, so, they try to, everyone is busy in their lives, so they will not offer the support. So, again, you have to communicate ki, these symptoms are happening with me. I'm feeling like this. This is like, you can communicate. They should do the effort to find out, read about it. And then they can offer their emotional and practical support, which you might need in, your structured routine. Maybe in the morning you want to go for walking, and but you use that time in preparing, the household activities, so someone can take the responsibility. You can go for the active walk for 15-20 minutes. And last but not the least, they have to accompany you with doctor. बहुत अच्छा लगता है कि अगर आपके साथ कोई हो. Some of the women they come alone, some they bring their husbands along with them. So then it becomes very like kind of a family affair. Everyone is serious, and everyone is, offering their part of solution to the issue.
Doctor, do you feel that the Indian men are not educated enough about this aspect?
Yeah, so as I said that Swati, a subtle shift is happening, but it's not in the entire way that they know. And these
Correct.
days we do show, like this topic has. I saw some of the Indian movies where this was shown that a woman is maybe going through some anxiety outbursts
Right.
due to this, but then it is not in a proper way. So we have to work a lot around it so that even men knows, and and then it becomes, a family issue which everyone is contributing to, in making the life better for everyone.
Right. Shall we take the questions, Doctor,
Sure,
from
sure.
yeah,
Yeah.
from the. So I think one was, can we have menopause after few years of hysterectomy also?
When, the hysterectomy happens, the uterus is removed. So once the uterus is removed, it is a surgical menopause. So a woman who has got her uterus removed will not have periods. So it's not that it has come at the time of surgery itself. So once the uterus is removed, you have a surgical menopause. So then there is no question of having it later, because already once the uterus is removed, your periods will end. You will not have periods.
So sometimes they say when there's a hysterectomy, doctor, that they keep the ovaries and only remove the uterus. Is there a reason for that?
Yeah, so what it happens that, say a woman, she's of 35 years of age or 38 years of age, and there were fibroids, whatever the reason might be, or there was some mild benign tumor, the uterus was supposed to be removed. They
Right.
leave the ovaries because of this reason only, that ovaries, they keep producing the estrogen which is required for the body. But
Right.
because the
Right.
uterus is removed, so the menstrual blood is shed off from the lining of the uterus itself. So once the
Mm.
uterus is removed, you will not have the periods. Ovaries are preserved so that they can continue producing estrogen for the body.
So this question asked by Lalit Joshi, do menopause factors and aging factors? So I think asking whether aging factors compound menopause symptoms. That's what I've understood. Is there any Lalit, would you want to explain that, or am I right in asking the question?
I precisely meant that only,
Okay.
that one could be these factors, and other could be that the person at certain age plus the children having moved out. So there are those factors also. So these two factors may be combining, and do they aggravate things, or create some issues, and how to keep them apart so that it is managed well.
Yeah, so Lalit very rightly said, as I said in my earlier query, which Swati had asked, that incidentally, menopause occurs during the age of 45 to 50 years, which is a time, when your children are moving out, you're aging. So certainly everything compounds, and sometimes it is an overwhelming situation for a woman. So that is how, the education and awareness to self by part of being a counseling sessions, either individual or group, knowing about menopause. And once you know that it is happening, of course there's a stress related to aging, there is a stress related to children, so everything compounds, but you have to tackle it symptom wise. So if you are having menopausal symptoms, so then you will do the interventions for them. And some of the interventions are common. So, like if you are having balanced nutrition diet, you are exercising, you have a plan for relaxation. So, those things are also being tackled.
One query was, doctor, that without raising red flags, is it possible for symptoms to go on for a number of years after actually you hit the cessation of periods? Say it happens around 50 or 52. Is it possible for those symptoms to go on for longer without being a cause of worry? Is it possible?
So normally, see, in most of the cases, the symptoms they'll settle down within 1 or 2 years. But as I said, that if they're persisting, then of course we need to evaluate them. We need to go for our checkups to see that if there's some other causes for it.
Okay, okay.
Yeah.
So that has to be checked up to ensure
Yes,
that
yes,
it's
yeah.
not a
We can't
problem.
live with the symptoms for a long time.
Right, right,
It's not advisable.
right. Also, Dipti says, how does a woman tackle symptoms at work in a country where this topic is still hushed away and without being labeled, especially things like mood swings?
Yeah, so Dipti has very rightly asked what we were discussing. Our country still, we are not very open about menopause. Women are very not open to talk about the hormonal changes. Leave beside in the workplace, they will not speak to their spouses also. Ki, look, I'm approaching this age and this is a change which I'm feeling. So they are a bit hesitant. So we have to talk about it, and thanks to you, for hosting session for such a kind of malign topic as per you. But it's a time that we should start speaking about this. And in many of the big companies like Adobe and Microsoft, they have menopausal support group also. They provide workplace safety support for
Okay,
menopausal women, those who are in this age group. So,
right.
Dipti, we have to talk about it, and we so that support is there. Yeah.
And also, yeah, I mean, a very, very pertinent question of, do men also go through this phase? And does it require a higher level of managing it if both in the partnership are going through it together?
So I think Lalit has asked a very interesting question. So you would see this term male menopause,
Yes.
wherein the men they go through the midlife crisis, and they have depression, anxiety, mood swings, maybe decreased libido also. But nothing like it that it would match the age. And yes, testosterone production, it decreases in men. but we do not have scientifically a term as
Right.
male menopause. Though, like we use it generally, but medical texts, they don't mention anything like that. But yes, men do have their midlife crisis where they feel anxious, they have depressive episodes, stress, anxiety, and so on.
Yeah, for men, I think it's more changes in the body, not necessarily a cessation of anything like in women.
Yeah, so though the testosterone production it decreases in
Right.
men, but
Right.
nothing like, stop kind of sudden cessation or stoppage, which
Correct.
might cause symptoms like hot flashes or night sweats and so on.
Right. Right. Yeah, I think
Yeah.
there's an observation that for men it could also be a change in lifestyle, retirement. That's a big issue for a lot of men who are stopping work after 30, 40 years. So
Yes. Yeah.
that
So
that could
stress due to all these things can be part of any sex, like,
correct.
either men or women.
Yes, right.
I have before you kind of we end the session, I have a very beautiful expression, by Iqbal to sum it up, for the women who are either approaching menopause or who are navigating. And it goes by this that तू शाही है काम है परवाज तेरा तेरे सामने आसमां अभी और भी हैं. So this is just a phase, and again, one thing which I wanted to mention that there are 1 billion women who are on this planet who are in the menopause phase, and women they have to spend 1/3 of their life, in this phase because with the longevity being increased. So
Yes.
please take it proactively, work upon it, and enjoy it.
So I think your beautiful message has inspired Deepti to ask one more question. And she says, what about irregular periods before menopause, like perimenopause symptoms?
Yeah, so Dipti, what happens is very rightly, perimenopause is a period which starts from 3 to 4 years before actual menopause. And what is happening is that gradually the hypothalamus pituitary ovarian axis, the gradually the hormones and the activation of the system is decreasing. So it is first of all, there is no need to be fearful that my periods are irregular. So it is a part of the natural menopause. And of course, there are ways, if these irregular periods are disturbing you, it can come in any form. Some women will have their periods 2 times within a month. In some the flow is increased, in some the flow is lessened. The periods are not irregular. So we do have progesterone treatments which regularize the period and can help navigate this time. But nothing to be fearful. Just like before we start the periods, we initially in the start of the periods, 1 or 2 years, the cycles are irregular. So these irregular cycles are part of the process, and we have medications to regularize them.
I hope that answered your question. Yeah, Deepti.
Yeah.
Sure. So I think thank you for that beautiful message. It was really nice. And it's really true that with longevity, we will be spending 1/3 of our lives in this phase and after menopause. And it's so important that we take care. So, you have given us such important advice. And I want to thank you for taking time and coming on our platform and speaking to all of us about this topic, which is still, I feel, in India is very hush hush, and it's very important for people like you to come forward and educate us on this. So Dr. Namita, thank you so much.
Yeah, thank you to you also, Swati, for hosting such a wonderful session and such a topic which is the need of the hour, and it is not very prevalent, and hope we can have more sessions with more participants. Thank you very
Thank
much
you.
for hosting
Thank
this.
you. Thank you, everyone.